How to manage strict sodium limits for liver ascites. Managing strict sodium limits in patients with liver ascites is crucial for reducing fluid buildup in the abdomen due to liver dysfunction. The main strategy involves a careful dietary sodium restriction alongside appropriate medical treatments. Patients typically need to limit their sodium intake to about 2 grams or to 1,000 milligrams per day. This is roughly equivalent to 5.2 grams of salt daily. Such a sodium restriction helps create a negative sodium balance, which is essential for reducing fluid retention and the formation of ascites. A no-added salt diet is recommended, meaning no salt should be added to food, and processed or pre-prepared foods should be avoided, as they often contain hidden sodium. This approach can help lessen the need for high doses of diuretics and may speed up the resolution of ascites. When it comes to dietary management, it is important to steer clear of processed foods like canned soups, processed meats, and ready meals, which are usually high in sodium. Instead, using fresh ingredients and herbs for flavoring can enhance meals without adding salt. Education is key, so working with dietitians and utilizing information leaflets can help patients understand the importance of sodium restriction and how to implement it effectively in their daily lives. Additionally, attention should be paid to medications that may contain sodium, such as effervescent tablets or certain intravenous antibiotics, as these can contribute to sodium intake and worsen fluid retention. Sodium restriction is often paired with diuretic therapy. Aldosterone antagonists like spironolactone are commonly used, sometimes alongside loop diuretics such as furosemide. Diuretics promote sodium and water excretion by the kidneys, enhancing the effects of dietary sodium restriction. Initial doses of spironolactone usually start at 100 to 200 milligrams daily, with careful adjustments to avoid side effects and kidney issues. Regular monitoring of serum sodium levels and kidney function is vital to prevent complications like low blood sodium or renal dysfunction. For patients with sodium levels above 126 millimoles per liter, water restriction is generally not necessary, and diuretics can be safely continued. If ascites becomes refractory, meaning it does not respond to medical management, more advanced interventions may be necessary, but sodium restriction remains a key component of treatment. It is important to note that excessively strict sodium restrictions below recommended levels can lead to malnutrition or worsen patient outcomes, so finding a balance is crucial. Patients should also avoid medications that could impair kidney function or worsen fluid retention, such as non-steroidal anti-inflammatory drugs and certain blood pressure medications. In summary, managing strict sodium limits for liver ascites involves adhering to a low-sodium diet of around 2 grams daily, avoiding processed foods and hidden sodium sources, and integrating diuretic therapy with close medical supervision. Patient education and support from a multidisciplinary team are essential for successful management. Always consult healthcare professionals for personalized advice and treatment options.